Hello, this video is for people that want to learn about non-surgical treatment for ACL tears. If you're currently going through an ACL tear yourself, first, I am sincerely sorry. I actually do understand what it's like to go through a major injury like that. And after I explain the types of patients that are most appropriate for non-surgical care of ACL tears, I'm going to go into the psychology of this rehab because I think that's one of the most important parts of this whole process. But unfortunately, one of those things that I think is very under talked about in the rehab and fitness world. Then we'll talk about the function of the ACL because it's important to understand what it does, so then you can understand how you can retrain the body to make up for that lost function. Before going any further, it would be irresponsible of me as a physical therapist to come on here and say that every single person who has an ACL tear should never do surgery. That's just not the case. There are some people where it is recommended to get surgery, and those people would be athletes that play in an agility sport like soccer, football, things like that, where there's a lot of cutting and pivoting. People that have on MRI showings that there's more than just the ACL tear. It's like the MCL, LCL, PCL, meniscus. Those things are compromised as well. And then the other population would be those that try non-surgical rehab and do every step of the process. They're good patients. They actually do the work, and they're still having frequent bouts of instability. Those three people would benefit from surgery. However, if you do not fit that criteria, get ready to have your mind blown about the amount of evidence supporting non-surgical treatment for the ACL. But before we get into ACL research, we're going to start with your mindset. If you're going into non-surgical care for your ACL tear, you have to go into that rehab believing that it is going to work. Research shows that people that go into a rehab protocol for any injury with an increased belief that it is going to work have drastically higher success rates than those going into the rehab not really sure if it's going to work or not. And I'm about to provide some anecdotal and research-based evidence about non-surgical care as a whole, and then specifically about ACL non-surgical care. Anecdote is $1 million word for story time. So here's story time. I personally have not torn my ACL, but I have torn my PCL and LCL. I tore my PCL when I was coaching high school wrestling, and a 16-year-old kid took me down. That was pretty humbling. And then I tore my LCL playing basketball in an adult league, and I got crossed over by a girl that played college basketball. So I'm obviously a pretty elite athlete, but I healed both of those on my own without surgery. No injections, nothing. I was just doing a lot of exercise. I knew how to progress the rehab to get my knee to kind of work around those injuries. And now I'm playing any sport I want with zero pain, no instability. That's just one story, but that's not an uncommon story. There are a lot of non-surgical treatment protocols that have the exact same, if not better, clinical outcomes than those that choose to get surgery for it. I entered into both of those rehab protocols knowing that it was going to work. I was convinced because of the research that I've done, the patients that I've seen. I'm blessed as a physical therapist to have the education that I have, and that's what this video is about, is sharing that with people that might not. I want to convince you that this is possible. And the best way that I know how to do that is to share research evidence showing that it's been tried and tried and tried and tried again throughout the years of ACL research, and it continues to show good results. All right, you ready? Here we go. Let me take out my little research book here. All right, non-surgical rehab for ACL tears. Previa et al. 6 patients in a 13th-month study returned to all sport activities with no new knee injuries after a non-surgical protocol. Filbay et al. 90% of an 80-person cohort showed signs of healing on MRI after just 3 months on a non-surgical protocol. Fuji et al. Fujimoto et al. That's fun. Fujimoto et al. 21 of 23 ACLs showed gradual reduction in image intensity, meaning the severity of the tear was improving. I mean, guys, that's pretty good. Oh, you want some more? Oh, yeah, I gotcha. Matthias et al. 14 of 14 patients aged 23 to 41 with an ACL tear showed normal or near normal knee radiographic findings 2 years after injury, with all of them returning to sport activities. Oh, and I'm going to throw this one in there. This one's fun. Tajay Spears, running back for the Tennessee Titans, currently does not have an ACL in one of his knees. Running back for the Tennessee Titans. Did you hear that? He's playing NFL football without an ACL. What does that tell you? I guess it's my job to tell you what it tells you. Okay, his body has learned how to adjust around literally not having an ACL in order to play one of the hardest sports at the hardest positions in the world. Wrap that around your head, put it in there, absorb it. What does that mean? It means it's possible to do this, y'all. All right, so now that you're hopefully a little bit more convinced that this actually is possible, let's talk about the function of your ACL. It has two main functions, one of which is really not talked about very much. The first one, though, being the fact that it prevents excessive motion of the knee. Most people know that. The other one is proprioception. We're going to talk about both. The ACL prevents the tibia from moving too far forward on the femur. So let's pretend that this is the tibia, this is your femur. When you're running, the ACL essentially prevents the tibia from translating too far forward, which is why if you don't have an ACL and you've not trained the body to work around it, it's going to feel like your knee's like very unstable, coming out of place when you do sports like football, soccer, things like that, where there's a lot of twisting and turning around the knee. Proprioception, on the other hand, refers to all those little mechanoreceptors in the ligament. Mechanoreceptors are those little guys in your body that essentially tell your body where it is. I know that's kind of vague and hard to understand, so the way I like to explain it is, if you were to close your eyes and I told you to point your finger up, you would know how to do that. That's because of your mechanoreceptors in your body telling you that this is up, this is down, that sort of thing. And those receptors are in the ligament. So when it's torn, you have this weird sense that you don't know where your knee is in space. You don't trust it. And that's a big part of the rehab that we're going to get to here in a second. It's estimated that the ACL provides the knee about 75 to 85% of its overall stability, where the muscles and nerves provide 15 to 25%. That's a pretty big gap, and it takes time to train it. That's why ACL rehab is known for taking sometimes upwards of a year. But there's two good pieces of news. First, your body is extremely plastic, meaning it has the ability to change rapidly. So that's something that your body's designed to do, is to heal itself, right? Number two is going back to the research. The ACL has shown signs of healing. So that 85% that was lost, some of that can come back. So eventually the muscles and the nerves won't have to work quite as hard, right, when the ACL is showing signs of healing. So how do you train it, JT? Great question. Well, everyone's program is going to look slightly different based on their previous experiences, their current strength levels, the severity of the injury, their goals in the future. So I can't tell you exactly the perfect laid out program for you watching this video. However, I am going to give you the main things that you are going to be focusing on in each phase of the rehab program and explain why you are working on those things. ACL rehab really comes down to training the things in your body that can be trained, the muscles and the nerves, to do the things that the ligament was doing. In the first phase, you're working on tissue healing and preventing muscular atrophy. The tissue healing comes from being in a brace that has the fibers of the ACL in a really close packed position, which optimizes healing. Preventing muscular atrophy is really important because there's a nervous system reflex in your body that happens after a major injury like this that shuts down muscles around it, which can lead to many more problems in the future, specifically the quad. The quad is going to put more stress on the ACL when it contracts, so the body's going to want to shut it down. You have to manually override that system to make sure that the quad doesn't lose too much strength. It's going to lose some, it has to, but you don't want it to be completely dead by the time the ACL has healed. So you do want to try some quad contractions that are non-painful. The other one that's really important is the hamstring. The hamstring is the ACL's best friend. It's going to help provide posterior stability during knee rotational movements, and it also helps glide the tibia back on the femur, which can help regain knee flexion if it's starting to get stiff. It's kind of like when if you're in a work team and one of the members goes on vacation and everybody else has to kind of make up for that missed person. That's what the hamstring is doing. It's making up for the ACL on vacation. Do you get paid more for doing that? No, that's the society that we live in. So Here's a pat on the back to the old hamstring. Thanks for doing the work. In the second phase, you'll be working a lot on stability and continuing to progress your overall strength profile, specifically in single leg stance, which we'll get to here in a second. But the reason that we're working on stability so much during this phase is that one of the main complaints, like 6 to 8 weeks out for most people, is not about pain. The pain is usually gone at that point. It's usually about the fact that they don't trust their knee when they're walking or doing certain activities. That's because their body has lost that proprioception. Remember what we talked about? So we have to train the balance system, the muscular system, to be on a single leg and feel itself being supported, have success in single leg stance. And that kind of shows the nervous system that, oh, it's okay to be in this single leg stance. We're learning how to do this again. And that's a big part of this phase, is getting the trust back in your knee. That's going to set you up for success in phase 3. Now that the strength and stability are back, phase 3 is about getting back to those types of movements that you want to get back to: running, jumping, cutting. Okay, and this is where the mental block typically comes in. I think this part is more of a mental challenge than a physical challenge, because your PT would not tell you to do these things if they knew that you weren't ready physically. The mental side of things can be a bigger barrier during this time. And really the way to get over that is through what we call in the physical therapy world the expectation violation. So we have to disrupt that expectation that you have that your knee is going to fall out when you do a jump or something like that. We need to violate that by showing you, gradually exposing you to slightly progressive challenges of you landing on one leg or producing force off of that one leg. Because if you don't get that back, that trust in your leg to produce that maximal force, your nervous system is going to essentially tell your body over and over and over again that it can't do it. And if that goes on too long, then yeah, doing explosive things like sprinting or jumping in your sport are going to be a lot harder, and you're going to lose that power and that performance when you return to sport. The last step is very individual to the person's goals. So if you're a football player, ballet dancer, coach of a little league team, whatever your sport or activity requires, that's what needs to be integrated into this part of the rehab. And this is, again, another mental block, especially if you got injured, if you injured your ACL doing that sport or activity. Your body remembers that, and it can be really hard to do the thing that caused the injury. But again, going back to the expectation violation, you have to experience yourself doing that sport or activity successfully again in order to truly get over this thing and to feel like you're back to being your old self again. All right, so those are the 4 phases of rehab. That's how non-surgical care works. And it works. Okay, I promise you guys, like, there's so much research that supports this. I would not be making this video if I didn't think that this was important information to be out there. And there's a ton of other creators that have made videos very similar to this. I encourage you to do more research. Be confident that you're about to go into a successful treatment. But going forward, what I'm going to do is also create an ACL reconstruction protocol. So if you have gotten an ACL restructured, or what's it called? Reconfigured. If you had surgery, I'm going to help you out with that. Okay, I can't talk right now. I've been talking a lot for the last 20 minutes. So look out for that video too if you have had surgery, or if you do plan on getting surgery later on. Please watch that video as well. Share this with friends. Share it with people that you think might want to watch. Subscribe to the channel too if you want. I'm going to be making a lot of posts about non-surgical care, things that I find cool about the body, things that I think people should know that I tend to take for granted. So appreciate you guys watching if you did. And again, if you're going through an ACL tear, just know I'm with you. If you need support, I'm here for you. So just let me know. All right. Cheers, y'all.